MPs have voted in favour of legalising assisted dying in England and Wales. The bill would allow adults with just 6 months left to live to request medical assistance to end their lives. Joining me now to talk about this is NHS consultant and member of our duty of care, Dr David Randall. David, thank you very much indeed for joining us here on Sky News. Given what happened yesterday in the House of Commons, how are you feeling today?
Yesterday, and I joined with the protest outside, and then I subsequently watched a bit of the debate. I was really struck by outside you had many people living with disabilities in wheelchairs pleading with MPs not to vote this through. Inside you had really passionate speeches being made about the impact this might have on vulnerable people, on minority groups, on people with mental health problems, on palliative care services. And unfortunately, 330 MPs didn't listen to those concerns and voted this through. I'm disappointed about that. I think the piece of legislation that's been voted through has lots of issues that will need to be addressed very, very carefully. I'm doubtful as to whether we can ever do this safely, but certainly MPs have got a major job on their hands now sorting out this legislation. And hopefully when they come back to a third reading, they'll actually look at some of these problems in a bit more detail and not pass this bill.
Yes, I mean, you're right there. This could take quite a while yet, maybe even 2 years before it hits the statute books, potentially, of course. Is that the issue for you? It's not so much the principle for people who want to do this, it's the risks to those who don't.
The risks are huge of people being coerced by others. We know that elder abuse is a major issue for many elderly people in our communities. The risk of self-coercion, of people talking them into this and feeling that they're a burden on society. We know that the NHS is not doing very well at the moment, and the provision of palliative care is not good enough. We can't end up saying that we can't provide people with good care, but instead, we'll offer to shorten their lives. For me, I think there's a bigger concern, which is that this will fundamentally change the way we as a society view the value of people who are living with illness or with disability. And I'm really struck by the views of disabled people. They are so strongly against this. They feel that this will change the way society views them. I think we need to be listening to people, not imposing our views, but actually listening to those groups who are saying to us so passionately and so powerfully not to go down this route.
But David, you can see from the other point of view, the majority voted for it, of course, in the House of Commons. Many of those MPs, one of whom in Sharnberry I spoke to earlier, engaged with their constituents, wrote to their constituents, listened to their constituents, and then voted with their consciences as well, and would say to you, we still value the contribution of people with disability in society, and this is not aimed at them. They will disagree with you on the risk to that group.
Well, I think we obviously need to listen to people. We need to listen to the people who are affected by this. Groups like Not Dead UK are very, very clear about what this would mean for them. And it's not for us to say, oh, you're overthinking this. There's nothing to worry about here. I think we need to listen to people with disability. I actually think that what unites people on both sides of this argument is that we need to do so much better for people who are facing terminal illness. I've seen that in patients I look after on the wards, that often the care we're giving is simply not good enough. Hospices are only a third funded by the NHS. For the rest of their funding, they rely on charitable donations and people running the marathon and selling cakes and this kind of thing. That's not acceptable. We wouldn't accept that for diabetes care or heart care or hip surgery. We have to be funding palliative care well, because when you do that, and when people get palliative care, proper palliative care, specialist palliative care, actually these requests for assisted dying go away.
David, I just need to finish off because I haven't got more full time. But you work in the NHS, and you will see firsthand the lack of support for social care impacting what you have to do in the health space. Just finally, do you think this overshadows that potentially much bigger problem?
No, I think so. I think this will be a distraction at a time when we have to be fixing services. It's very interesting that the Health Secretary is against this because he says at the moment the poor care we're often delivering acts as a coercive pressure to ask for assisted suicide. We can't go down this route. We have to fix care, particularly social care and palliative care.
Dr David Randall, appreciate you joining us here on Sky News this morning. Thank you.
Thank you very much.